In its first ever report on high blood pressure, the World Health Organization found nearly half of adults with hypertension don't even know they have it, which is scary because it's known as a silent killer. Dr. Wahaj Aman, interventional cardiologist with UT Health Houston and Memorial Hermann, is here with the root of the cause, and it has to do with some sneaky foods. If you take a look here, I bet you can guess what side we're talking about. Welcome, and thanks for being here today.
Thank you so much.
The silent killer, that's frightening. It goes back to a lot of times we are what we eat, right? Diet plays a huge role in
Absolutely,
this
it
problem?
does, yes. And so, in this day and age, really the first step of prevention starts at the grocery store, and we have to be very careful about what we're buying and what we're putting in our bodies.
So how, I understand it could even cause a 10% difference of what you eat, and that's a lot when you're talking these numbers.
These numbers can be life-changing if you really focus on your diet. Yes, 5 to 10 points in your blood pressure can really make all the difference in the world, between a heart attack and a stroke and then just living better. Yeah, absolutely.
I can't help but just enjoy taking a look at these foods. Everything over here is nice and bright and healthy. Over here, not so much. What is the difference? Can eating healthy foods actually lower those numbers or keep them more stable?
Right. So the American Heart Association, for patients who have high blood pressure, they recommend about 1,500 milligrams of sodium. Well, if you start looking at labels and discussing this, for example, if you want to make a sandwich, a couple of slices of this ham, the American cheese, and if you add some ketchup to it, well, you're more than halfway done with your sodium intake for the day already, as opposed to sort of whole ingredients, fruits and vegetables that go a long way in reducing sodium intake as far as your
and sure, you could get some roasted nuts that are just completely covered in salt. That's not going to help you out. I see we have some all-natural almonds here that don't have anything on them, and they taste really good. If you just have to get used to that taste, I've found, and then you never look back, right?
This is like small incremental changes that you make to your diet. Just add a little bit more nuts, that are unsalted, like you said, a little bit more fruits, a little bit more vegetables to your diet, and before you know it, you're on your way to getting better blood pressure.
And it can be in the sneakiest places, salts in, major salt in soups and pasta sauce, all kinds of places. So read those labels, look at the sodium levels, and we think of, a dash of salt here and there doesn't add up. So it's really ironic that the DASH diet can actually help. What is that, and how does it work, and how might we want to consider it?
We absolutely, especially if you're at risk for hypertension, if you already have hypertension, this is a DASH diet is something to consider, primarily based on, again, whole ingredients, more fruits and veggies in your diet as opposed to more processed meats and products. So that's primarily the cornerstone of DASH diet, and then within that there are multiple recipes that we can try on a day-to-day to improve our health. People
need to know their numbers. They don't need to just go to the doctor once a month, once a year, and see what their blood pressure is. They need to be checking it. How often? And you can get a monitoring device for really, dollars, but how often do you want them to check that blood pressure?
So if you are at risk, I would say to my patient at least 2 to 3 times a week, once a day in the morning after you wake up, before you take your medications, to sit in a quiet place, especially if you're sitting, and then check it a couple of times and take the average, I would say.
When you say when they're at risk, are we talking obesity, family history?
Yes, so obesity, family history, if you're a smoker, if you lead a sedentary lifestyle. Another big one is if you have sleep apnea. And this is another one that I think not enough people talk about, is sleep apnea is such a huge risk factor for not just hypertension, but heart attack, stroke, and things of that nature.
Well, and we just need to remember that those are life-threatening problems. It can be treated. Is medication the easiest way to do that?
Yeah, so I think number one is always
lifestyle.
To talk about lifestyle,
right.
100%. And then yes, there are affordable medications, and they can make a huge difference in your blood pressure.
Got to exercise, get that body moving too. It just
100%.
Isn't what we eat, right?
Yes, absolutely.
A few simple tips from the doctor can save your life. It doesn't get any better than that, is what I had to say. Dr. Aman, thanks for taking time from UT Health Houston and Memorial Hermann.
Thank you so much.
You're always so helpful, and now I'm ready to eat that apple for breakfast.
Let's do it.
How about you?